My name is Dr. John Legarreta, and I'm a board-certified ophthalmologist and cataract surgeon. Today, I'm going to discuss what you need to know about cataract surgery, from what causes it, to your surgical options, to how you'll recover. So let's get started. To understand cataracts, you first need to know a little bit about how your eye works. The front of the eye is called the cornea. It's a clear window that helps focus light. Behind that is the iris, the colored part, which controls how much light enters your eye. And sitting just behind the iris is the lens, a transparent structure that helps you focus on objects both near and far. So, what are cataracts? Well, a cataract is when that clear lens becomes cloudy and hardened. This cloudiness blocks light and makes your vision very blurry or dim. If left untreated, the cataracts do get worse over time, making it harder to read, to drive, or even to recognize faces. So you might be wondering, well, what causes cataracts? Your lens is made of water and protein. Over time, the proteins start to clump together, and that's what causes the clouding of the lens. Cataracts are mostly caused by aging, but UV light exposure, diabetes, smoking, and certain medications, like steroids, can also speed cataract development up. Now that you know what a cataract is, how do you treat it? Well, the only way to treat cataracts is with surgery. It's the most common surgery performed in the United States, with over 3 million surgeries being performed every year. It's fast, safe, and typically takes around 10 to 15 minutes. You'll be awake, but relaxed with sedation. When I talk to patients about cataract surgery methods, I always say there are two ways that cataract surgery is done: laser-assisted and then manual blade surgery. With laser-assisted cataract surgery, a computer-guided laser makes highly precise incisions and gently breaks up the cataract for removal. The laser also helps with correcting your astigmatism and can improve the accuracy in placing the lens in your eye. Laser surgery, though, often comes with an additional cost. With the traditional manual blade surgery, the surgeon will use a handheld blade to make the incision and then break up the cataract with ultrasound energy. This method is very effective and is typically covered by insurance. So after the cataract lens is removed, a new lens is placed inside of your eye. This is called an intraocular lens, or an IOL. The lens is permanent and it rarely ever needs to be replaced. And so with these lenses, you do have options. Monofocal lenses focus at one distance. You'll likely still need glasses for reading and for computer work, and possibly for distance correction as well. If you have astigmatism, a toric lens can help correct this. And for those individuals who want to reduce or eliminate glasses as much as possible, a multifocal lens may be the best option, giving you vision at near, intermediate, and far distances. Now, if you have cataracts in both eyes, we typically treat one eye first and then schedule the other eye within a few weeks of the first. This allows your first eye time to heal and adjust. And before surgery, we will take some measurements of your eye shape, curvature, and length to help choose the best lens for you. Before surgery, you'll start using your prescription eye drops 3 days prior to the procedure, and you'll want to space out each drop so they fully absorb before applying the next drop. On the day before surgery, you don't want to eat or drink anything after midnight. You don't want to wear makeup or jewelry to the surgery center. You want to arrange for someone to drive you to and from the surgery center as well. To arrive for surgery, your eye will be dilated and you'll be given numbing drops and a light sedative. The procedure will take about 10 to 15 minutes. Afterwards, you'll be given some instructions, some eye drops, and a clear protective eye shield. You'll also be offered something to drink before going home. After surgery, your vision may be blurry for a day or two or even a week. That's normal. Most patients see improvement within the first week after cataract surgery. You'll also continue using your prescribed eye drops for several weeks after surgery. And remember, you don't want to rub your eye, you don't want to lift heavy objects over 10 pounds, no swimming or going underwater for about a month, and you want to avoid being in dusty, dirty environments while your eye is healing. So after going through all this, I need to tell you that cataract surgery is one of the safest procedures in medicine, with a success rate over 98%. But unfortunately, like any surgery, there are risks. These risks include, but are not limited to, infection, swelling, loss of vision, and the need for repeat surgery. Some people also develop what's called a secondary cataract, months or even years later, and this is what we call a posterior capsular opacification. The good news is that is easily fixed in the office with a quick laser treatment. So now I'm going to go through some common questions that I get about cataract surgery. Number 1, does it hurt? Typically not. It's usually painless, and remember, you'll be relaxed and comfortable during surgery. Will I still need glasses? Well, this really depends on which lens you choose. Can the cataract come back? The good news is no. Once it's removed, it's gone forever. But you may need a laser later on to clear up the cloudiness on the lens capsule. Is the laser surgery worth it? Well, this really depends. For many patients, especially those with astigmatism, yes, but it really depends on your goals and your budget. So I'd like to conclude by telling you that cataract surgery is a life-changing procedure. But the key is choosing the right approach for your eyes. And you want to review your options and make sure that your lens choice matches how you want to see the world. Thanks for watching the video. I hope it was helpful.